Chronic insomnia is devastating for your brain, and the consequences are more serious than you think. If you struggle with chronic insomnia, you might be unknowingly accelerating the decline of your memory and cognitive abilities compared to those who sleep well. Simply put, your brain could be aging faster than it should. But here's where it gets controversial. A recent study published in the journal Neurology, https://2021.https ver www.neurology.org/doi/19155 reveals a strong link between chronic insomnia of difficulty sleeping at least 3 nights a week and a significantly higher risk of developing mild cognitive impairment or dementia. This isn't just about feeling tired the next day. It's about long-term brain health. Diego Carvalho, a neurologist at the Mayo Clinic and co-author of the study, explained in a statement from the American Academy of Neurology, medicalexpress.com/news 2025-09 Insomniacs brain aging.html. Insomnia doesn't just affect how you feel the next day, it may also impact your brain health over time. We observe a faster decline in cognitive abilities and brain changes that suggest chronic insomnia could be an early warning sign or even a contributing factor to future cognitive problems. Tracking brain aging, what the numbers say. To be clear, the researchers do not claim that insomnia directly causes brain aging, but they highlight a strong association. The study followed more than 2,500 cognitively healthy individuals, averaging 70 years old, over approximately 5.6 years. Among them, 16% suffered from chronic insomnia. During the study period, 14% of those with chronic insomnia developed mild cognitive impairment or dementia, compared to only 10% of those without insomnia. After adjusting for factors like high blood pressure, use of sleep medications, age, and sleep apnea diagnosis, the researchers found that people with chronic insomnia had a 40% higher risk of developing these cognitive issues. To put it in perspective, this increased risk is equivalent to aging an extra 3.5 years in terms of brain health. Additionally, their performance on cognitive tests declined more rapidly. Digging deeper, those insomniacs who reported sleeping less than usual in the 2 weeks before the study began scored lower on cognitive tests, equivalent to being 4 years older cognitively. They also showed more white matter hyperintensities, which are areas of potentially damaged brain tissue, often linked to small vessel disease, and a higher buildup of amyloid plaques, a protein closely associated with Alzheimer's disease. Remarkably, the level of amyloid plaque accumulation in these individuals was similar to that seen in people with a known genetic risk for Alzheimer's. Why brain resilience matters and how sleep plays a role, Carvalho emphasized. Our findings suggest that insomnia may impact the brain through multiple pathways, not only involving amyloid plaques, but also affecting the small blood vessels that supply the brain. This highlights why treating chronic insomnia is crucial, not just to improve sleep quality, but potentially to safeguard brain health as we age. Our study adds to growing evidence that sleep is not merely about rest. It's essential for maintaining brain resilience. Interestingly, participants who reported sleeping more than usual in the 2 weeks prior to the study had fewer white matter hyperintensities at the start, suggesting that even short-term improvements in sleep might benefit brain health. Limitations and what you should take away. The researchers acknowledge some limitations. The insomnia diagnoses were based on medical records, which don't capture the severity of symptoms or include people who might have undiagnosed insomnia. Despite these caveats, the takeaway is clear. Prioritize getting enough quality sleep. If you're struggling to do so, seek professional help. So here's a question to ponder. Could chronic insomnia be a silent driver of cognitive decline that we've been overlooking? And if so, should sleep disorders be treated as aggressively as other risk factors for dementia? Share your thoughts. Do you agree that sleep deserves more attention in brain health discussions, or is this association overstated? Let's discuss.